Age UK and the General Medical Council wanted to understand how to encourage more effective conversations about advanced care planning. They commissioned Britain Thinks to design and run a day-long workshop in London, bringing together 18 members of the public and 6 doctors. Many members of the public knew very little about advanced care planning. In contrast, doctors are much more familiar with the phrase. However, this can be an emotionally challenging issue for both groups.
Before I came along today, I knew nothing. I had a complete blank about any sort of forward planning.
From the doctor's perspective, I think actually it can be very difficult because we go into medicine thinking we want to cure everybody and make everybody better and everything lovely. And the reality is that doesn't always happen.
We shared a definition of advanced care planning with participants. The public and doctors interpreted this definition very differently, pointing to a need for 2 separate conversations. Firstly, a broad conversation that takes place when an individual is in good health.
Initially, one would get a letter from either the GP surgery or the health authority saying, right, for a woman you're 60, you're coming up to retirement age, or you come up to 65. For a man, for your retirement age, have you thought about the consequences of getting old and making provisions for yourself?
The second conversation would be about the treatments or interventions an individual might want to receive under specific circumstances.
The family and the patient and the doctors know what to expect, what the options are, and they know that everybody is doing the things that the patient would want.
Both doctors and the public identified barriers to effective advanced care planning conversations.
This isn't a conversation that most people would have with anyone, with friends, with family necessarily. It's not a topic that's discussed over the dinner table. And so when it's raised by a doctor, it can be uncomfortable or clunky or frightening.
My own GP is terrific. I mean, I could have a discussion with him at any time, but not every GP would like to discuss these points with you. They haven't got the time.
Challenging the taboo will require a significant cultural shift towards thinking ahead and forward planning.
I think it would be very helpful if that conversation was backed up by the fact that there's been some kind of public campaign or whatever, so it would, for the person who's receiving that conversation, they think, oh yes, this is out there.
The public would be more prepared for what the doctor was going to want to discuss with them, and they might already have thought about some of the answers.
Finally, participants worked together to develop key recommendations for the second conversation about specific interventions.
Continuity would be vital to me, and then do it in stages, do the plan stages, because maybe as your condition goes on, you might need to change that care plan.
Sometimes a good conversation about advanced care planning can be a patient saying they don't want to do any, but it's about that feeling of engagement, that partnership, and that normally only comes once I've built a relationship with that person.